Most stomach symptoms are harmless, but some are early warning signs of something serious, and most people miss them. If you have any of these 6 symptoms, you should not ignore them. I'm a gastroenterologist, and these 6 symptoms I take very seriously. The tricky part is that serious conditions oftentimes start with very common symptoms, such as heartburn or bloating. This is where a lot of people get falsely reassured and it delays diagnosis. The first red flag sign is unintentional weight loss. You're not trying to lose weight, but you're dropping pounds. This is even occurring while you're eating the same amount of food and you don't have a decrease in your appetite. The second red flag sign is blood in the stool. This could either be black tarry bowel movements or it could also be bright red blood from your rectum. And bright red blood from your rectum usually comes from the lower GI tract. It could be something simple like hemorrhoids, but there's a possibility it could be a precancerous polyp or colon cancer. A black bowel movement or black tarry bowel movement could be associated with an upper GI cause of bleeding. If you want to hear more about rectal bleeding, please see my previous video about this. A third red flag sign is anemia or fatigue. This is feeling exhausted or having a very low iron level. The best way to further evaluate this to make sure that you're not anemic is to talk to your primary care provider to check a complete blood count to verify your count is not low. A fourth red flag sign is worsening or progressive difficulty swallowing. So this swallowing gets worse over time, and it could initially start with solid foods, but as time goes on, potentially due to something narrowing in your esophagus or at the beginning of your stomach, then the swallowing issue could become even with liquids and pills. So the fact that this is getting worse and worse and worse over time is a concerning sign. A fifth concerning sign is persistent vomiting. This is not a one-off episode of vomiting, but vomiting that persists weeks after weeks. The sixth red flag sign is a persistent change in your bowel habits. So if you had normal bowel movements and you see that you're having worsening constipation or pencil-thin stools, this needs to be further evaluated, especially concerning if it's new onset after the age of 40 to 45, because obviously as we get older, there's a higher chance there could be something more concerning that is found out during an evaluation. Here's what I tell my patients. Having one of these signs does not mean that you have cancer, but it does mean that you need to see somebody to get it checked out. So when should you see a doctor? Any of the red flag signs that I mentioned lasting for 2 to 3 weeks. If you have a family history of gastrointestinal cancers, such as stomach cancer, esophageal cancer, or colon cancer, you should have a lower threshold to get these symptoms evaluated. Also consider seeing a doctor if you have a combination of these symptoms. If you're dealing with IBS or bloating symptoms, watch this next. I will go over what is actually normal and what is not.